Hey guys, it's Dr. Nelson from Carolina Active Health. Today what I want to go over is a common injury that we see in our office, and that involves the disc that sits in between the two vertebrae. So the intervertebral disc, it's a piece of cartilage, and this is a great model, love this model, that sits in between. The cartilage itself is kind of like a wood grain pattern. So you can think of different layers, or an onion, different layers that kind of go to the outside. The inside material is actually gelatinous, so there is some shock, there's some squishiness to the disc itself. Now, from an injury standpoint, the most common injury that we see is repetitive flexion and extension. So you can think of somebody who has to bend a lot for work, somebody that installs flooring for a living, somebody who is a CrossFit athlete who does a lot of repetitive flexion extension, a new mom that has to bend down and pick their kid up a lot. So what we see is that posterior portion, so if this is the backside of the vertebrae, tend to wear down a little bit from that repetitive motion, so bending over and over and over. What actually can happen from that, so it works, the disc material, the nucleus pulposus, which is that gelatinous material, works its way to the outside layer. And so the initial phase from that, we hear what's called a disc bulge. It's basically pressing that outside layer into the spinal canal. Now, what is really cool about this model, and this shows when we go into a flexed position with some pressure, you can almost see some oozing material that comes out. Now, if that material presses into the nerve root, that's when we get referred pain. That's when sciatic pain comes into play, or other levels depending on kind of where the herniation is. That's also one of the reasons that the mechanism that we treat often is repetitive extension. So we kind of do the opposite position. Now, this is also why we've gone through neutral spine. A really important part of preventing this from happening is to make sure that we're not excessively flexing through one segment over and over and over. The concept of having a neutral spine and maintaining kind of that position is thinking of, when I'm flexing, taking the force away from the vertebrae, from the disc, and transferring that force into my hips while maintaining stability through my low back. So again, kind of from a bending standpoint, if I think of moving through my hips instead of bending from my back, that's a great way that we can take strain and stress away. Also, sitting is another common area that I see with these. So if we think of a good sitting position as keeping neutral in our spine, whereas we live in a world where this is kind of a normal sitting position, trying to make sure that we're addressing those issues outside. If you've dealt with any disc issues, please comment below, or feel free to reach out to our practice. We'd love to help you with that.